I think like many other people, we, have seen the pictures and, I think everybody wants to help. I feel kind of fortunate because I happen to have some skills that are particularly needed in Haiti. But, and they asked me this same question before I left. I'll be honest with you, it's fairly straightforward. I think we all just want to be able to help in the most direct way possible.
Yeah. Tell me a little bit about just what the camp was like when you first arrived. What did you think?
Well, I think we were prepared prior to actually arriving on the scene. We were prepared for a considerably less elaborate field hospital. What we actually found was something that was set up in an orphanage. It's a gated center with security. A lot more extensive than we thought. There were existing facilities there in the form of some of the schools that were used for the orphans, and the Love a Child Foundation was very nice to allow us to stay there and use some of their, not only the buildings, but the property. There was an artesian well system for water that was safe to drink. There was electricity in the form of generators. It was just a much more sophisticated operation than I had anticipated. And I think what was most striking is that it was a very international and, within the United States, multi-institutional collaboration. So it was far more extensive and I think well organized than we were expecting when we first left. There was a lot of resources for surgical expertise and certainly a lot more equipment compared to what we had brought with us. That doesn't mean that there wasn't a great need for non-operative orthopedic care, and that's really what I ended up doing, is managing the triage unit, which was the intake for a lot of the patients that had been treated in the Dominican Republic, as well as in other sites, including the USS Comfort, that were now being repatriated back into Haiti, and were in desperate need basically of post-operative care. And much of this was done very haphazardly in a very obviously, there's a lot of different practice patterns that exist there, different resources to take care of these patients, and we're trying to ensure that we know as much about the care of these patients as well as their needs as far as rehab, wound care, etc. So my essential role was to assess these patients as they came in, make decisions about whether they required surgery, interact with the various medical and surgical teams to ensure that they received the appropriate care as they stayed there.
How do you discharge somebody from a camp like that? I mean, if you're homeless and legless in Haiti, that doesn't sound very promising.
Well, I think that it's interesting because as Americans, that's what we would expect if it were ourselves in this society. And I've worked in a lot of other countries where they provide, the community actually helps to support these individuals. So yes, amputations, there are limitations in terms of mobility, but what was so striking, I think, about a lot of the people in Haiti is they work at a community level to help each other. And so I think that's something that really is very different perhaps than what we're used to in the United States. So how do you discharge them? Obviously we ask a lot of questions apart from just their medical issues about, do they have a home to go to? Many of them lost many family members and had very limited resources in terms of friends and families to take care of them, but we would ask them. And we would certainly, if they had no place to go to, help refer them to the IDP camp where they did have access to medical care. There was running water, food, a tent for shelter, and again, a community of Haitians who they may not have known before, but seem to be very, very good at working together and helping each other. Yeah. It was deeply gratifying to be in a position where you could truly not only help people, but see them improve over time. I think one of the real highlights for me as an orthopedic surgeon, and it emphasizes sort of the limitations of surgical care, is one of the frustrations was that at the beginning we actually have very limited personnel and no physical therapy. So you could do surgery on patients, you could care for them, you could assess them, tell them that they could bear weight, but we just didn't have enough people to go around and actually help people get up. There were too many people, all of them needed the same kind of basic physical therapy, and we had a group of physical therapists that came by during our second week. and they hit the ground running, and they had these individuals up. And again, from personal experience as an orthopedic surgeon, that's what we all want to see, is to see patients that have received care that are now, were afraid to put weight, afraid to walk, afraid to mobilize and mobilize their joints, and to see them get up and show everybody else in the camp that they could do it. And it's a chain reaction. It really, for me, was a major change in what we were doing there. And I think we all also, we have our own clinical vignettes of patients that we cared for, and inevitably these patients were extremely grateful for what we were able to do, even if there was very little we could do. So I think that what were the highlights? It's really the thank yous that we got from the people that we cared for, and seeing towards the end that we were able to provide not just surgical care, but that that physical therapy that was so important.
Did you get to see much of the country, or did you never leave Fond Parisien?
I had the opportunity to do that, and I will be perfectly frank with you that had nothing to do with my concerns about security. But you're seeing the human toll that the earthquake had on the Haitian people. It's hard enough to kind of deal with that, and we were in an area that was not damaged physically, certainly not in any visible manner by the earthquake. But the stories from a lot of the patients we took care of were very shocking. To go into Port-au-Prince and see, side by side with the patients, the physical damage of the city, which, from what I've told, is absolutely shocking, I think would have been overwhelming for me. I think it was, I wanted to focus on the patients. There are a lot of people also taking pictures, not as tourists, but they're also not doing much to help, and I certainly didn't want to be one of those individuals. So I did choose to stay. I had the opportunity to go, but I think that it really would have been overwhelming to see, both the human and physical toll that the earthquake took.
Mm-hmm. If you were going to give advice to the next team going down, the guys who just got there, what would come to mind first? What are the things that people wouldn't think of?
Well, I think that we anticipated the kinds of needs that that the people at the field camp needed. If I were to give advice, and this is what we did tell the group that followed us, everybody needs to keep in the center of their mind why they're down there. They're there to help, and they need to be adaptable. They need to be flexible. This is not a room or a space where you want to have many big egos. You really just are there to help in whatever way you can. So my advice is to really keep your perspective, help in any way that you can, and learn from them, because it's quite remarkable. These are some very strong people that draw upon a tremendous sense of spirituality to get through this. We didn't go to a location or a country where people were crying and depressed all the time. They moved on with life, and I think they did that through the community networks that they have in Haiti, and again, a very deep sense of spirituality that they draw upon. So we have a lot to learn from them, as much as we can teach them about certain things.